Hey everyone, you ever get those medical bills that just make you want to scream?
Oh, yeah.
Well, we're diving into a new poll today that really digs into how Americans feel about healthcare. It's from Periundum and YouGov. And honestly, the findings are wild. We're talking about everything, Medicaid, the ACA, you name it, and trying to understand what people actually want when it comes to their care.
It's really a fascinating puzzle. You've got all this frustration, especially about the cost of healthcare.
Oh, for sure.
But then you see strong support for programs that people think are like really government heavy.
It's like we all agree it's broken, but can't agree on how to fix it.
Exactly.
So this poll found that most Americans, they're super frustrated with healthcare costs, obviously read.
Yeah.
But get this, they actually like programs like Medicaid and the ACA.
Yeah.
How does that even make sense?
Well, you got to think about it this way. People, they want affordable care, right?
Of course.
But they're also kind of suspicious of, like, the big insurance companies. And they're suspicious of the government trying to do too much.
Right.
So it's this real tension. Like maybe someone had a good experience with Medicaid, got coverage they could afford, so they like that, even if they don't love the idea of the government running everything, you know?
So it's all about what you've actually experienced.
A lot of it, yeah.
Makes sense. Okay, let's zoom in on Medicaid then, specifically.
Okay.
Because this poll, a whole 80% of people see it in a good light. That's huge GE. And yet, all the time, we hear about cutting it when budgets get tight.
Well, you can't forget the political side of things. Like a lot of Republicans, their goal for years has been to shrink what the government spends, right?
Right.
And Medicaid, that's a big program, lots of money, makes it a target. But this poll saying maybe that's not what most people actually want.
Especially when you see how the poll breaks down.
Yeah.
Support for Medicaid, it's highest among the people who've actually used it yet.
Makes sense, yeah.
It's like they're saying, this thing worked for me, so leave it alone.
Exactly. Lived experience, it matters a lot when we form opinions about these programs.
For sure.
Like, it's easy to have a debate about some policy in theory, but when you see how a program helps you or someone you know.
It changes everything.
Yeah.
Okay, so let's get specific. The poll asked about different ways to CUT Medicaid.
Okay.
So there's per capita caps, which is like setting a limit on how much the government spends per person.
Right, right.
Then cutting money for states that expanded Medicaid under the ACA, taking away guaranteed coverage for certain groups, and adding work requirements. Like, what did people think about all that?
This is where it gets really interesting. See, even if someone generally wants smaller government, less spending, there's no agreement on these cuts.
Really?
Yeah. Some ideas, like those work requirements, get a bit more support, maybe because people think it makes folks more self-sufficient.
Okay.
But others, like messing with those per capita caps or taking coverage away,
Yeah.
those are unpopular with pretty much everyone. Even within the Republican Party, people disagree on a lot of this.
Huh. So it's more nuanced than just cut Medicaid.
Way more.
People actually think about the details.
They do.
Okay. What about the Affordable Care Act? Remember all that repeal and replace talk?
Oh, I remember.
What's the poll say about that, NW?
Well, get ready to be surprised because the ACA, it's getting more popular. Like 73% of Americans now see it in a favorable light. It seems people got used to it, saw the benefits.
Wow, 73%.
Yeah.
That's a big change from a few years back when it felt like everyone wanted it gone. What happened?
I think it goes back to what we were saying before, right? Experience shapes opinions.
Okay.
Remember those debates about letting insurance companies offer worse plans or charge sick people more?
Yeah.
Those ideas were really unpopular in this poll. People want to feel secure, like things are fair in their health care.
So they want the good parts of the ACA to stay,
Yeah.
but maybe they're still hoping it could get cheaper.
Exactly. And that leads us to something, a bit of a blast from the past. Remember the public option.
Public option.
Right.
Remind me.
That idea of a government-run health plan competing with the private ones.
Oh, yeah.
It got dropped from the ACA way back when, but guess what? The public option's making a comeback. This poll found 55% of Americans, even 45% of Republicans, they like the idea.
Hold on. The public option. I haven't heard that in forever. It's like that band you loved in high school suddenly putting out a new album. Why is it popular again now?
Well, think about what we've been talking about. People are FEDUP with the system as it is.
Right.
They don't trust the big insurance companies.
Nope.
And they don't trust the government to do it all either.
Yeah.
Plus, they want more options that are actually affordable. Public option seems to hit all those points for a lot of folks.
Okay, so it's choice. Maybe it brings costs down, by making those companies compete. And it's not like going full single payer, which people are nervous about.
It's like a compromise a lot of people can get behind.
So remind me, it's like a government-run insurance plan, but it competes with the private ones. Wouldn't that mean more government in healthcare, which we said people are wary of?
That is the interesting part, isn't it?
Yeah.
But the poll also showed people like things like Medicaid, the ACA, those are government run too.
True.
So it's not that people are against government doing anything. It's more like they want it to work well.
To actually be efficient, help people.
Yeah, make their lives better, not more complicated.
So less about ideology, more about results.
Exactly. And that's what's hard for the people making policies, you know? It's not enough to just cut stuff or change things based on some idea. They got to show those changes actually solve the problems people care about.
Like being able to afford their care and getting good quality care.
Yeah.
Okay, so where do we go from here? Because we've seen people aren't happy with how things are, but they're also unsure about some of the solutions. Can we bridge that gap?
That's the million-dollar question, isn't it?
Right.
I don't think there's one easy answer. But this poll, it's like a map, you know?
Okay.
It tells us what matters to people, what they'll maybe accept, and what they definitely don't want. The folks making decisions, they got to take that seriously, use it to guide them.
So listen to people, figure out what they're really worried about, and find solutions that deal with that, not just push some agenda.
You got it. And that's why polls like this one are so important. They show us what the public is thinking, and it helps us understand, like, the finer points of all this healthcare debate. It's not as simple as left versus right or government versus private. It's about finding solutions that work for everybody.
Right. Well, this poll has given us a lot to consider.
It has.
But what does it mean for the future of healthcare in America? Big changes coming. Or just little tweaks here and there.
Trying to predict the future, that's always tough, especially with something as complicated as healthcare.
For sure.
But this poll, it does show people want things to change. They're frustrated, they're paying attention, and they're demanding something better.
So they're not just going to accept things as they are.
Not at all. And that's a good thing. Because at the end of the day, healthcare's future depends on us, the people. Yep. We got to stay informed, make our voices heard, and hold those elected officials accountable.
So we can't just leave it to the politicians to sort this out. Like, we all have a part to play.
You got it. This isn't just something we watch from the sidelines. This is about our health, our well-being, our future, and we got to be involved.
Okay, so what can we actually do? How do we make sure we're heard and push for real change?
First off, stay informed. Read articles, listen to podcasts like this one.
Right.
Talk to your friends and family about this stuff. The more we understand how healthcare works, the better we can fight for solutions that actually work.
So knowledge is power, like they say.
You know it. And once you have that knowledge, don't be afraid to use it. Contact your representatives, tell them what you think. Share your stories, what you're worried about, your ideas.
Like we were saying earlier, those real experiences, they matter. Sharing them can change the whole conversation.
Exactly. And don't forget the power of, like, collective action. Join groups that are fighting for better health care. Go to those town hall meetings. Support the organizations doing good work.
So there's strength in numbers.
Definitely. The more people speak up, the more likely we are to see real change. Remember, this is about our health, our future, and our right to health care that's affordable and good quality. We can't just stay quiet.
Wow, that's a powerful message. Sounds like we got to go beyond just complaining about healthcare and actually do something.
Complaining's fine, but it's not enough. Got to turn that frustration into action.
Right.
Got to demand better from our leaders and work together to build a system that works for all Americans.
This has been really eye-opening.
Glad to hear it.
I've got a lot to think about now. But before we finish up, got to touch on something we haven't really discussed. The politics of all this.
Yeah.
It's a new era for healthcare policy, new administration, Congress trying to figure all this stuff out. How do you think this poll will change things on the political scene?
Well, it's clear the poll shows us how divided the country is on this, right?
Absolutely.
It's hard to find any agreement, so trying to change the system, someone's going to be unhappy.
Sounds like a political minefield.
In a lot of ways, yeah. But T, the poll also shows us some things people do agree on. Even with their differences, Americans share some basic values about healthcare.
Okay, like what?
They want it to be affordable, they want good quality care, and they want the system to be fair to everyone.
So maybe those shared values could be a place to start?
Yeah.
For a better conversation?
Exactly. If the politicians focus on those and really listen to what people are saying, then maybe we can move past all the fighting between parties and find solutions that actually work.
So we need a new way of approaching healthcare policy, one that's practical, where people work together and they're really committed to doing what's best for people.
That's it. We got to move past those old arguments and work together to make a healthcare system that's fit for the 21st century.
Well said. This has been an amazing deep dive into American healthcare. We've seen the good, the bad, and everything in between.
For sure.
But the biggest thing we've learned is that healthcare's future is up to us. We can't just sit back and watch. We got to be in the game, demanding better, holding our leaders accountable, working together to make the system what we want it to be. Thanks for joining us on this journey, and keep those conversations going.
It's funny, isn't it? This poll shows how different things are for regular people versus what's happening in Washington.
Oh, totally. It's like two different worlds.
Yeah.
On the one hand, Americans are saying, we want affordable health care. They like Medicaid, they like the ACA.
Right.
But then you've got politicians talking about cutting those very programs.
It's a huge disconnect, and it shows how hard it is to be one of those policymakers. How do they balance what people want with all the pressure from their own party?
Especially with healthcare, it's such a personal thing for people, right?
Absolutely.
Like, take the ACA. We said it's getting more popular, but some Republicans still want to get rid of it. They think it's the government doing too much.
It's a perfect example of how what a party believes can be totally different from what regular people want. Makes you wonder, will the politicians listen and change their minds? Or just stick to their own ideas, even if it's not what people want?
That's the big question, right? It's like, what is representative democracy really? Are they actually representing U.S.?
And that's why WE have to stay informed, get involved, can't just assume they know what's best.
Right?
We got to speak up, make them listen, and make sure they're working for U.S.
So it's not enough to just vote every few years. We got to be active all the time.
Exactly. This conversation never stops, and our voices need to be part of it. Write to your representatives, go to those town halls, join groups that are fighting for better health care. There's lots of ways to get involved.
So we can't just sit around waiting for things to get better. We have to make it happen.
You got it. This is about our health, our lives, our future. Can't be passive about this stuff. We got to be active, shaping the healthcare system we want.
Okay, so where do we go from here? We've seen this gap between what people want and what's happening politically. But we've also seen some areas where people do agree. Can we bridge that gap and build a system that works for everyone?
I think we can, but it's going to take a new way of thinking about healthcare policy. We got to be practical, work together, and really focus on what people need. No more fighting over old ideas. Let's find solutions that actually work.
It's like, stop using healthcare as a political weapon and start treating it like the basic human right it should be.
Exactly. Healthcare isn't about Democrats versus Republicans. It's about people. It's time we started acting like it.
Couldn't have said it better myself. This has been an amazing deep dive into American healthcare. We've seen the frustrations, the contradictions, but also some hope for the future.
Yeah, absolutely.
But the biggest takeaway, the future of healthcare is in OUR hands. We can't just sit back and watch. We have to demand better, hold our leaders accountable, and work together to build the system we deserve. Thanks for joining us, and keep those conversations going.